One of the most awkward things in the operating room is when you're operating with somebody that is a different height than you. And there's like an unspoken etiquette in the OR where you can't really ask the senior person to change the height of the bed unless it's really causing a problem. When they scrub in, they're the ones that kind of dictate how high the bed is. And so if there's a height discrepancy, it's possible to use a step stool to kind of close the gap between the two heights. Like if the OR table is too high for one person that is shorter can use a step stool. But it gets awkward when the more senior person is shorter than the assistant, because then the more senior person will usually just have the table lower, and then the taller person kind of has to struggle a little bit to do what they need to do. And it gets a little bit more challenging if you use things like a microscope or loupes where the focus really matters. Like the distance between the lens and the actual surgical field will make a difference. And so sometimes taller people will struggle to kind of get their focus in the right level because the OR table is always lower than what they prefer. The best thing is when you have somebody that is aware of others in the OR and kind of realizes that it's not ideal and will adjust the bed so that it's perfect for everyone, but those people are pretty rare.